If you have shoulder pain, do you need an x-ray? I'm Daniel Lawrence, you're watching the Physio channel, and in this video, we're going to answer that very question. Do you need an x-ray if you have shoulder pain? In this video, we will also discuss x-ray incidentals. If you don't know what they are, they're important, so stay tuned. This video also features Dr. Derek Adu-Sarkodie, who runs an educational YouTube channel called AduMed. Dr. Derek is a medical doctor and general practitioner here in the UK, and this is his first collaboration with the Physio channel.
Thanks for the wonderful introduction then. Hi everyone, my name is Dr. Derek. I'm a clinical lead GP, and I'd like to talk to you about another shoulder condition known as our rotator cuff disorders. Now, I'd like you to take a look at this image here. Our rotator cuff are a group of muscles that are located around the shoulder joint. And the main function of these muscles and tendons is to stabilize the shoulder joint and to connect the head of the upper arm to the shallow sockets of the shoulder. Now you can imagine that any issues with the rotator cuff can cause so many different symptoms depending on which rotator cuff muscle is affected. So you can get pain at the top of the shoulder, on the side of the shoulder, and also a little bit of discomfort on lifting your hands up. Now, a lot of patients come to me with this condition, and a really common theme here is people that have repetitive movements of the hands above shoulder level. So it's important to identify this in your life, and if you can alter these different activities, that can lead to an improvement in symptoms due to rotator cuff disorders. Now, let's answer the question I know you all have in mind. Do I need an x-ray to diagnose rotator cuff disorders? Well, let's have a think about this. We know that our rotator cuff disorders are due to the muscles. Now, x-rays show up our bones and the joint spaces. So you can see here that x-rays are probably not the correct way in which we can investigate for this condition. And so if a doctor wants to, get to a further diagnosis of this condition, you may be referred for an ultrasound scan, which is a lot more accurate means of actually coming to the diagnosis of a rotator cuff disorder. Now, in terms of managing this condition, you've got the over-the-counter medications such as ibuprofen and paracetamol, which are really effective. Now, a mainstay is physiotherapy because it's really important to rehabilitate the shoulder joint and getting things healthy again. And with that said, I'd like to pass you back on to my lovely friends at the Physio channel.
Dr. Derek, thank you for joining us, and we hope to see you in another video soon. So if your shoulder hurts, do you need an x-ray? In the first instance, it's a simple question to answer. If you have any of these indications shown on the screen here, then it will be either a good idea or important to have an x-ray for your shoulder. I will read through the list and then we'll go through each one in turn and look at them in more detail. So quickly reading through the list on the screen here, we have significant trauma, traumatic dislocation, severe pain without cause, progressive loss of movement, progressive increase in pain, sudden deterioration, and red flags, which I will explain further. First, let's consider significant trauma. This refers to sudden physical trauma, such as a fall that puts a high degree of load through the shoulder. Pain is usually sudden and clearly linked to the incident. Here, an x-ray may be required to check for bone fractures. Next on the list is traumatic dislocation. Sudden force or trauma can cause the shoulder to dislocate. An x-ray may be required to check for bony injury. Next on the list was severe pain without cause. Experiencing severe joint pain without a known cause can elevate anxiety levels, which in turn can make the pain worse. An x-ray is a quick and relatively inexpensive way of assessing the internal structures of the shoulder and hopefully provide some reassurance that there's no actual damage. The next three things on the list were a progressive loss of movement, a progressive increase in pain, and a sudden deterioration. These type of presentations could indicate a frozen shoulder. An x-ray can differentiate between this and osteoarthritis. Tumours, although rare, will also be spotted on x-ray. X-rays can help to improve or change the treatment approach. The final thing on the list was red flags. Let me explain these in a bit more detail. If you're unfamiliar with the term in medicine, it means signs of serious pathology, which means there is an indication that you may potentially have a serious medical condition and more testing is required to check this theory before forming a diagnosis. Red flags for shoulder pain may include a dull shoulder ache that continues or is worse at night and is not related to movement. Painful lumps in the soft tissue around the shoulder, but also non-painful lumps in the soft tissue around the shoulder, are also potential red flags if you're experiencing ongoing shoulder pain. So what are X-ray incidentals and why is it important to know? So quite simply, X-rays look at structure and they look at things that we can't see in the human body. What they often show are anatomical variations and changes that might be termed age-related changes. So incidental findings on X-ray are usually anatomical variations and they're usually not related to the pain that the patient is experiencing. No two shoulders are the same and therefore no two shoulders look the same on X-ray. Unless X-ray findings are explained correctly and in the context of the patient's pain, then these incidental findings risk making the patients feel worse, increasing their pain, and potentially leading to unnecessary treatments and unnecessary surgical procedures. So it's commonly agreed that unnecessary X-rays for shoulder pain can lead to an increase in the pain experience and can lead to a poorer prognosis, especially if the X-ray is performed with the wrong expectations from the patient and is explained out of context and is presented in a way which shows the incidentals as potential problems. Thanks for watching. Please share this video with anybody who you know who may find it helpful.